Flowcare peg placement. The placement of a peg tube is indicated for long-term tube feeding, more than 2 to 3 weeks, and for stomach decompression. The Nutricia Flowcare peg is intended to be placed using the pull technique under endoscopic control. Flowcare pegs are available in Charrières 10, 14 and 18 and are offered with different types of feeding connectors. Preparation. The Flowcare peg set consists of the following materials: a transparent polyurethane tube 40 cm in length with a radio-opaque line, a silicone internal retention disc, 12 cm markings starting from the internal fixation disc, and a hydromer-coated tip with loop, a polyurethane feeding connector, a pull wire with loop, an introducer needle with trocar, a scalpel, a 90-degree silicone external fixation disc, a blue safety clamp for acquired tube fixation, and a white quick-release clamp. In addition to the peg set, the following materials are required: a flexible endoscope with biopsy forceps, syringe with local anesthetic and long IM needle, small container with water to moisten the tube. Placement. Place the patient in supine position. The patient is prepared as usual for endoscopy. Administration of a prophylactic antibiotic should be considered. If possible, explain the procedure to the patient. Normally, peg placement is performed under mild sedation. If this is not the case, a topical anesthetic of the vocal cords should be considered. Pass the endoscope into the stomach and inflate the stomach. With the room lights dimmed, locate the appropriate puncture site by placing a finger at the point of maximum transillumination of the endoscope light. Palpate the abdominal wall to ensure the colon is not obstructing access to the stomach, and check this with the endoscope. Mark the chosen puncture location. Clean the entire abdominal wall with a disinfectant and put sterile drapes around the puncture site. Use the long IM needle to inject, at the marked puncture site, a local anesthetic into the skin and in all layers of the abdominal wall. Insert the needle into the stomach cavity, keeping the needle in view of the endoscope. With a scalpel, make an incision of approximately 4 to 5 mm in length at the chosen puncture site. Push the puncture needle with the trocar through the incision into the stomach cavity and grasp the trocar with the forceps. Remove the puncture needle and leave the trocar in place. Insert the pull wire through the trocar and grasp the wire with the biopsy forceps. Dip the tip of the tube in sterile water for approximately 10 seconds to activate the hydromer coating. Pass the loop of the wire through the dilation loop and over the internal retention disc and pull snugly. Pull the wire exiting the abdomen. This way the tube is pulled through the mouth down into the stomach cavity and pulled out through the abdominal wall using the dilation tip to dilate the exit site. The hydromer coating on the dilation tip will facilitate this. Pull the internal retention disc of the tube snugly against the stomach wall. Check the position of the internal retention disc endoscopically. Cut the tube below the conical tip. Slide the external retention disc over the tube and secure it by lacing through the disc. Keep the disc tension-free against the skin for approximately 24 hours. Ensure the correct positioning of the external fixation disc is maintained by placing the blue safety clamp immediately behind the disc. Place the white quick-release clamp over the tube. Push the metallic part of the feeding connector completely into the tube. The tube placement should be confirmed endoscopically or by X-ray. Record the brand name, the Charrière, and the introduced length of the peg in the patient's medical records. Tube feeding may commence 1 hour after successful peg placement. However, preferably 6 to 8 hours after peg placement in order to prevent peritonitis. Care. The external fixation disc and safety clamp may be loosened 24 hours after placement of the peg. Allow a distance of approximately 5 mm between the external fixation disc and the skin in order to place a sterile Y-compress under the external fixation disc. Inspect the stoma site daily for any redness and swelling. Disinfect the skin daily. As soon as the stoma is completely formed, it is important also to wash, rinse and dry the skin thoroughly. Always keep the blue safety clamp in place, also during wound care. The clamp indicates the correct position of the external fixation disc and guarantees that the tube is fixed back in its correct position after wound care. Turn the tube daily 180 degrees on its axis and move the tube up and down in the stoma, a minimum of 1.5 centimeters. The position of the flow care peg should be confirmed every time a new Nutrison pack or bottle is connected, if there's any doubt about the position of the tube, and at least 3 times a day. Verify that the external fixation disc and blue safety clamp have not been dislocated, and if possible, check the pH value of aspirated gastric contents. Flush the tube with 20 to 40 ml of water before and after the administration of feed or medication, and at least every 8 hours to prevent tube blockage. If the tube does get blocked, flush the tube with lukewarm water. Do not use excessive pressure to prevent tube rupture. Use a syringe larger than 20 ml. If this does not help, gently squeeze the tube between your fingers along the length of the tube. Do not use any other fluids to flush the tube. Inspect the condition of the peg daily. Any significant change to the peg, discoloration, hairline cracks, leakage, etc. should be reported to the attending physician. It is recommended to use disinfectants based on polyhexanid. Please read the instructions for use on the packaging and guidelines. Immediately stop feeding and ask for medical help in case of doubts concerning the patient's medical condition.